Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. Today, I wanted to share a little success story. The patient I'm about to tell you about, we met about 6 months ago. He's in his 30s and was going about his life doing all sorts of normal things. He's really nearsighted and he started to notice a lot of floaters in his right eye. And he went to go see a general ophthalmologist and they suggested he come here to have a look at his retina after they found a lot of trouble. And here is all the trouble. You see over here, there's a big retinal tear. It goes all the way from down here and all the way up. There's another retinal tear right there, and there's also a little bit of bleeding. And you can tell the retina is totally detached all the way from here over all the way down. Now, if we actually scan the macula with an OCT study, we can see that the retina is totally okay right here. But if you look over here, there's a little puddle of fluid underneath the retina. The distance between here and there is about 2 millimeters. And so this person, even though they can see practically 20/20 with a lot of floaters, they're destined for blindness. If this retinal detachment that's off to the side progresses all the way there, then what this person is going to see is a shadow off to the side and it's going to march its way forward and they'll be totally blind. So just thinking through this case, this person has what we call a giant retinal tear. That is a retinal tear that goes all the way from here all the way down. It covers about 4 clock hours. There are also multiple tears. There's one here, etc. And this person is practically 20/20. When we discuss retinal tears that lead to retinal detachments, when they're like this, when they have giant retinal tears, then the chance of having trouble in the future with conventional surgery is really high. Even after something like a vitrectomy or scleral buckle or whatever surgical procedure we recommend, the chance of this retinal detachment returning is really high. People are really high risk of developing something called proliferative vitreoretinopathy, which is essentially scar tissue. When a wound is really big like this, it really stimulates the immune system to show up to try to help, which inevitably can be counterproductive and cause the retina to redetach. So when I met this person, I told them, we're in for a whole journey here. We're gonna have to combine things. That is, do a vitrectomy, take out the gel, do a bubble, and then also do a scleral buckle. That is, place a band around the eye to help the retina reattach. And now here this patient is about 6 months later. The vision is pretty decent. The scleral buckle is this thing right here. All these marks are laser marks, and you can see this kind of indentation off to the side. It actually goes all the way over here too. The whole band goes around the eye, and you're just seeing little bits and pieces of it. And the retina is totally attached. One way to demonstrate this is by scanning the retina. Remember over here there was fluid underneath the retina? It's totally gone.